But our big story tonight is India's COVID crisis that worsens now by the day. Active cases now 5,40,720 in the country. But just in the last 24 hours, 56,211 cases have been added. So India every day is adding more than 50,000 cases. Deaths, the mortality rate remains more or less constant. Deaths in the last 24 hours are 271. But with no let-up in the rising COVID cases and hit by what many are now calling a second wave with over 50,000 cases in the last 24 hours, the centre is urging states to ramp up testing and tracing to keep the virus in check. But is the country better prepared now than they were 1 year ago for a COVID virus wave? It's our top story tonight.
From poor to very poor. In a span of weeks, India's coronavirus situation has deteriorated drastically, a fear echoed by the Health Ministry.
We are facing increasingly severer, intensive situation, more so surely in some districts, but the whole country is potentially at risk, and therefore all efforts to contain, to save lives should be taken.
Without glasses.
India in the last 24 hours reported more than 56,000 new COVID cases. But the magnitude of the situation could be understood by the fact that India has recorded its last 1 million cases in just last 30 days.
The virus is still very active, can penetrate our defenses. We can have all the vaccines in the world, but we will for a long period of time need to be also dependent upon masks to protect us, protect our families, protect this community.
Centre has asked states to ramp up its testing and tracing mechanism and has urged private hospitals to play a bigger role in India's vaccination drive.
We are seeing only less than 6,000 vaccination sites are being run on a daily basis on an average by the private sector. The registered number of private sectors is much more, perhaps about 20,000 to my knowledge. So we want a greater participation because we want to, shall we say, accomplish this job the quickest possible time.
With Milan Sharma, Bureau Report, India Today.
So how should one be dealing with this second wave of the coronavirus? I'm joined by the country's top epidemiologist from Vellore, Dr Jayaprakash Muliyil joins me. Appreciate your joining us, Dr Muliyil. When you see this rapid surge in cases, the country adding more than 50,000 active cases a day, should we be surprised? Should we be alarmed with this sudden rise in cases? How do you respond?
Well, whenever certain patterns emerge, it is quite annoying and worrying. But let me tell you something. There was a logical reason why this rise took place. You know, in September when the cases were coming down, it was quite surprising because we had not yet reached a level of herd immunity. Even in urban clusters, in many of them, they expected 60%. So I think what happened was our population was quite dimorphic. In other words, there are two people. One group very careless or couldn't afford to be careful. And then they got infected, and that is the rise we saw first. But there was a group, educated, well-to-do, who could afford to wait it out. And they were permitting the herd immunity to act earlier than expected. In other words, the virus was not finding enough host. But I think they changed, their behavior became a little more relaxed. And this whole rise is mainly occurring in areas where previously the incidence of disease was low.
I want to understand what you're saying, Dr. Muliyil. Are you saying that the rise is only due to COVID inappropriate behavior and not because there are new and potentially more dangerous mutants and variants that are coming in?
Well, I pointed out to one of the reason, that is our own behavior, which we have seen happening in the media, people walking around without any protection, and crowds being gathered together. So that was expected. But the point is, even people who were cautious earlier, when they saw this declining trend, I think relaxed a bit. That's number one. Now coming back to this question of variant, we have to live with variants all our life. So you can't be frightened of variant. The thing is, it is quite possible there may appear a variant which ignores the immunity granted by the earlier infection. Now that would be quite upsetting. Till now, we haven't seen any evidence. Practically all infections have been on previously uninfected people. There are some variants who transmit faster than the old virus, but that shouldn't bother us. The problem will be if it changes the clinical profile and seriousness of that illness. It hasn't been established yet. So I don't think we need to press any panic button. And my guess is, if you look at the number, the same way it has gone up, it will come down.
You're making an important point. You believe that the numbers will come down in a few weeks. This is part of a pattern. But are you still confident, doctor, of something you told me a few months ago, that we were inching closer to herd immunity? If we were, then what explains this recent surge?
Yes. The reason is, we are asked the question, why did the number of cases come down in the first place? What are the reasons? And the reason was that people once infected were immune to future further infection to a large extent. So the virus was not finding new homes. But new homes came as a present, because when we started relaxing our norm, then the virus could spread again. So I think the herd immunity is something that is there for certain. And that prevents outbreaks like it's a standard norm. The point is, when large clusters of people who have been very careful come in front of the virus and expose themselves, then the outbreaks can be very large. Remember, it's a very large country, and our expectation was 60% should become immune in the cities and 40% in the rural area. These are fairly rough estimates, but by and large, we expected the herd immunity to set in when half the country is infected.
You know, you're saying though, doctor, that there is no need to press the panic button. But the question is, what should one do as policymakers when the cases are rising? There is one view that we need a re-lockdown, especially in cities like Mumbai. The other view is that what we really need is a speeding up of the vaccination process. Which, according to you, is the best way forward? Much faster vaccination or another lockdown?
I would vote for speed up the vaccination process. And we have the vaccines, luckily, and I don't think we are in short supply or anything. And we have a system which can deliver it. Lockdowns never helped. Now, lockdowns help in certain countries where they could afford to have lockdown. In India, that is not so. Remember, every day we lose something like 250 people due to COVID. But there are many other people who die because of other illnesses. And you go through an unrestricted lockdown and prevent people from reaching hospital when they need, the livelihood is affected, that'll be a greater disaster. I think some sort of a restraint on people meeting, gathering together, traveling together will be helpful. Remember, this subset of the population who are really being exposed now are the ones who were careful to begin with, patiently waited, and now the vaccine has come, their wait is almost over. Right. It's a pity we had to face the outbreak again.
But Dr. Muliyil, we know of cases of people who have actually got vaccinated, particularly the first dose, and are now getting reinfected in some instances. Should that not be worrying that there could be variants out there that are bypassing the vaccine also now?
No, this is remember, the vaccine is primarily aimed at reducing the chance of serious illness or death. The logic is based on the fact if an individual is previously exposed to the protein, his cells will remember them. So when actual virus comes in, even if it stays for a short time, it cannot cause disease because the immune response will be excellent. So what we need from the vaccine is truly reduction in serious illness and death. And these vaccines are clearly providing it. Reinfection is not an anxiety at all. It is in a sense that we wish it didn't even allow the virus to occupy our body. But not having that is not a serious background. Remember, natural infection imparts a very solid immunity, and reinfection after natural infection was extremely low for certain biological reason. But the vaccine also provides good immunity without having the risk of people dying. So I think we have reached a phase where judicious use of vaccine and a little more restraint for a short more period of time, we should be able to go through this business without any panic.
Dr. Muliyil, the other concern is why is it that only some states like Maharashtra, Punjab, Karnataka seem to be reporting, Gujarat reporting a high surge in daily cases, half a dozen cases, states accounting for 78% of the fresh infections. Why is it that only some states seem to be affected poorly? Because inappropriate behavior is all across the country. So why do some states only see a surge?
Yeah, it depends on this clustering of people who live a secure life. In certain cities, even when we looked at specific areas of clusters and compared within one city, there are some clusters with very high seropositivity, certain other clusters low positivity. So there are emergence of these clusters for socioeconomic and educational reasons. And there are large clusters. And if you notice, certain parts of the Maharashtra are down, but certain selected districts are going up. And I think historically, during the last 1 year, those areas had lower incidence of
So net, doctor, are you saying this wave is far milder than the earlier one? Many asymptomatic cases who are recovering within 4 to 5 days, mortality rates still at the same level as the past. No need to press the panic button. Is that what you're telling me now in conclusion?
Well, every time there are new strains coming up, you have to watch out. If the virulence is increasing, is virus misbehaving. Now, even now, a large percentage of cases are subclinical, which is comforting thought. Similarly, the mortality pattern also has not changed noticeably, okay? But I'm sure the Ministry of Health is keeping a watch over it. And as far as I can see, it is still the very elderly who is succumbing to this infection.
Right.
So there are more deaths, of course, because there are more cases. But it is, remember, India was fortunate that we had a much lower death following infection compared to many other countries. And that's true of not only India, many other South Asian countries in Africa.
So if we were to speak 1 month from now, doctor, you're confident we will be in a much safer zone, that the worst will be over in a month from now?
I am positive.
You are positive, Dr. Muliyil. So you're giving us a positive message. The next month, crucial, maintain COVID-appropriate behavior, but step up vaccinations. That's the key. Appreciate your joining us, Dr. Muliyil, as always, on the News Today. Now,
hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.